Welcome to Ask the Experts, presented by Salinas Valley Memorial Healthcare System. I'm Claudia Otero. Today we're focusing on COVID-19 and the flu virus. With us today are Dr. Kelsey Gray and Dr. Min Lei. They both specialize in pulmonary disease and critical care at Salinas Valley Memorial Hospital. Now, thank you so much for being here with us today. We're going to be asking a lot of questions about both viruses, so we do appreciate you being here. We're going to begin with COVID. Can you describe what the last 21 months have been like treating so many patients at Salinas Valley Memorial?
It's been very challenging for our community who suffered a lot of loss with COVID. And it's been challenging on the healthcare system. We, at one point last year, for several months, more than half of our hospital was filled with COVID patients. During our peak, we had 2 of our intensive care unit doctors having to round on all of our COVID patients who are intubated, meaning that they are on the ventilator. And unfortunately, we did see a lot of loss, and some families lost several of their family members, and it was very sad. At this point, we've seen some improvement in our numbers, and that's because people have gotten vaccinated, and our county is doing quite a good job at making sure we have outreach, and that's why we're here today, to make sure that we provide as much information as we can so that we can make sure that our county is safe, it's open, and that we don't suffer any more of the loss that we've seen. That's been very difficult.
And Dr. Lei, I know you're new to our healthcare system, but you were treating patients in Michigan. Can you elaborate a little more?
Yeah, so actually for the Salinas aspect, the last 2 or 3 months or so, it hasn't been much different at all compared to the experience in Michigan, which is, it's tough. The family members, like Dr. Gray was saying, experience something they've never seen, something that's unheard of to them, and very life-changing. There's a lot of family members that realize that this is more severe than they can anticipate, and they've lost their loved ones to them. I've seen many family members during this time cry and reach out for help, and we do our best. But the experience has pretty much been the same as I experienced in Michigan. It's been tough. The numbers are down, but when they're sick, they're very sick.
Mm-hmm. That's right.
And I think we have of late seen some critically ill patients with COVID, and it's really been unvaccinated patients who've been the sickest. I've had several patients who have actually told me right before we were putting them on the ventilator that they wish they would have gotten vaccinated and to tell their family members to get vaccinated. And I'm sure you've had that same experience, and it's chilling, and it's very sad, because vaccination for COVID-19 does prevent critical illness, and that's a very important message that we want to get across.
And as physicians, it must be incredibly frustrating for you, because you've saw that first wave where we didn't have that weapon, right, that vaccine, and there was little you could do for them. Now we have the vaccine, and then we see this other wave of unvaccinated people who simply just chose not to receive it, and here they are, and there you are taking care of them. So we can only imagine what it's been like for you and other physicians dealing with this. Recently, one of our ICU nurses wrote an article about what it's like for patients who are hospitalized and then eventually make it into the ICU because they have COVID. He wrote an article, we produced a video, and we would like to share that with you now. Let's watch.
This is COVID-19 by Steve Lasowski, registered nurse, Salinas Valley Memorial Hospital. Imagine you wake up one day with a runny nose and fever. You go another day or two and continue to feel worse. You go and get tested, and lo and behold, you test positive for COVID-19. You are taken to the hospital where you are isolated from other patients. You call your wife and speak with her in short sentences because you are having a difficult time breathing. The doctor comes in and tells you that because of how you are doing, they need to transfer you to the intensive care unit. One morning, a critical care physician, or intensivist, walks in and says because of your breathing, your muscles will tire out. They need to put a tube down your throat to help you breathe. They are going to give you a medication to put you to sleep. You are looking around, and then everything fades to black. You are still not getting better. We have video calls set up where your wife and maybe your oldest child get to see you with all these tubes in you. Do you know they are there? You've been in the hospital a month. The next day, the hospital allows your wife to come see you. This is a farewell. Did you feel her touching you? Did you hear her say goodbye? Soon after, we give you a certain type of medication and withdraw the tube from your lungs. You don't stay with us long. Your ravished lungs can't oxygenate you. I decided to write this article because I was really concerned about everything that I was seeing on the COVID unit and the progression of the COVID virus and how frustrating and harmful it really was to my patients. And I was just really frustrated with the idea that COVID was not dangerous and that most people would be fine and that most people would be okay. I remember distinctly one family who had to say goodbye to their loved one via the iPad, and there was a whole group of people cycling through as I held the iPad, and it just felt so awful that these people were not going to get to see their loved one again ever in person. Listening to the wailing and the screams, literally screams, of these people as they accepted the fate of what was going to be happening to their loved one I had a lot of nightmares for a while. I want people who read my article to understand the seriousness of the COVID virus, how it is a life-changing virus for many people, how it affects not only you, but your family, the community. It's not something to be taken lightly. What we probably remember the most, we don't speak of. It's how much you suffered, despite everything we did. Get the vaccine. This is COVID-19.
To read the full article, please visit svmh.com. Now, Dr. Lay, Dr. Gray, in that video, Steve talks about intubation and extubation. Can you walk us through that process? I mean, how do you prepare for that? How do you prepare the patient?
You know, first of all, we do everything we can to prevent intubation. So, you know, we do all the therapeutics that we can. We do all the supportive care. And we have different oxygen modalities that we can use, such as something called high flow nasal cannula oxygen, where we can put higher flows of oxygen through a special nasal interface and give up to 100% oxygen through that. Some patients are lucky enough that that's sufficient. Unfortunately, some patients with COVID develop acute clinical worsening, and it's unlike anything I've ever seen before in my career, where all of a sudden they're doing okay, and then the next second you get a call from the nurse, or if you're on the floor, you go to the bed immediately, and you know it's time to intubate. And you do your best to prepare to let the patient and the family know through our communication that there is always this possibility. We always make sure that that would be something that the patient would want. Some patients wouldn't want to be on the ventilator, so we also discuss and honor the patient's autonomy and what they would want, and discuss that with the family as well. And then if it's indicated, we intubate, and that can be a dangerous process, and maybe you could take that over.
Yeah, I don't think there's a great way to prepare a patient, but what Dr. Gray outlined is the best practice to prepare a patient. I think the emotion they go through and the physical trauma they go through and experience is something that we cannot relate to. It's nothing like television or anything that someone can describe. It is painful, it's daunting, and it's life-changing. And it leaves patients debilitated if they get off the life support. And that's the key thing we want the population to know, is that being intubated does not necessarily save your life. it's very close to the end, and it's the last measure to try to save the patient's lungs and oxygenation. Now, will they ever get off of it is another question, and we can discuss that later. But in terms of the intubation, I don't think anybody can ever be prepared for that. And patients that do get extubated that have told me they would never want that again.
And of course, we give medications to make sure that they're comfortable during that process and don't suffer. We have a whole team of people that the number one goal of that whole team, and as us as the intensivist directing that team, is the patient's safety, and that the process goes as well as it possibly can. But again, we do everything we can to try and prevent intubation. And one of the best ways to prevent that is vaccination. We just got our boosters, and I'm very thankful for that as healthcare providers and as providers of care to COVID patients. And then the extubation process, COVID is a very different disease, like I said, than I've ever seen in my career. I went through the H1N1 outbreaks of 2009 and 2012, and those were very challenging. We had a lot of sick patients, a lot of patients who were dying of the flu at that time. But COVID patients, when they're critically ill, they get very sick very fast. They can be improving. We could be talking about extubation or taking the breathing tube out, and then the next minute they acutely worsen, and there's no more talk of taking the breathing tube out. And I don't know if that was reflective of your experience in Michigan.
That's exactly the same thing in Michigan. The physiology and the pathology of this virus is nothing seen before in textbooks or described by any other viral illness of the lung parenchyma or the lung tissue. And like Dr. Gray said, it's tough to extubate. And some people, actually most people, fail extubation, or most people are just not safe enough to be extubated. And it's unfortunate.
Yes. And then, as we've seen as providers in the community, we've seen a fair number of patients who unfortunately may not have been hospitalized or have been hospitalized who have developed long COVID. And I saw one of my patients in my office who had COVID a year ago and is still suffering, has not been able to go back to work, is still very short of breath, has been up to UCSF, evaluated for lung transplant. She was young, working, has a family, and her life and her family life has been devastated. And she didn't have access to the vaccine because it was too early. But she, in her community, has really encouraged vaccination and has really been able to, she was telling me she was able to convert some people who were scared of getting the vaccine for COVID, and she's been able to get them vaccinated. And so it's been, she's taken a lot of pride in that, to use her story to help others.
Well, we wish her the very best, and we're happy that she's been able to help other people just by sharing her story and just getting them to the point of them wanting to receive the vaccine. Again, a lot of people are still very hesitant to be vaccinated. Children, what do you want to tell parents and just the general public who are still holding off for whatever reason?
So, for the general public, I strongly recommend getting the vaccination. It's been proven to be safe. There is no significant adverse effects, and it's actually been proven with great scientific literature and medical literature with data in multiple countries, not just our country, to be effective against multiple variants. As for children, also, there is supporting data for that as well, without any significant adverse effects or sequelae of the vaccine to affect children or adolescent teens. I also strongly encourage parents to push for vaccination for their children as well.
And you're a parent, and
yeah,
If
that's a very great point. If my child had to get vaccinated, he's a toddler, but if he were to get vaccinated, I would definitely want him to get vaccinated. It would protect the community, it'd protect him, it'd protect us. It's unfortunate that there is probably misnomer or misinterpretation of what the data is out there for people to be hesitant. But as medical professionals, I think Dr. Gray would also agree that we strongly encourage it. It's been proven to be safe, and it's probably the best weapon, as she mentioned earlier, against this virus.
It prevents critical illness and hospitalization, and we want to save people's lives, and I think getting vaccinated is the way you save people's lives.
Since the new school year started a few months ago, we've seen hundreds and hundreds and hundreds and actually thousands of children throughout the country getting very sick with COVID. Now there's a vaccine. There's still people out there, as I mentioned earlier, who feel like the vaccine was produced way too quickly, not just for the adults, but also for the children. So what do you want to tell those parents who are maybe just going to the wrong place for information? What's your advice to them about specifically the vaccine for children?
So my advice for these parents is, yes, it's good that you do your research. It's good that you try to find the side effects, the pros and cons of what you're giving your child and yourself. Totally agree. But I'd also recommend discussing with medical professionals such as us instead of just any random news outlet or media that seems that they know what they're talking about. This is something we deal with on a daily basis on the front line, and we keep up with our medical knowledge daily. So if there's any hesitancy or questions, I highly advise you to go to your next door doctor, your primary care, or even us, the pulmonologists, and talk about it. On that note, we could discuss further what the research shows and talk about what we call evidence-based medicine, and you can make an informed decision of what you'd like best for your family. We're never here to push or force upon any decision you're not comfortable making. But based on what we know and our knowledge of it, I would say Dr. Gray would probably agree with me that we would definitely encourage getting the vaccine.
I would agree. I think, we anticipate that there's continue to do studies that the eligibility for vaccination for children will continue to be lowered as we have more and more data. And I've had friends who are also physicians who have enrolled their children in some of the clinical trials so they could get their children vaccinated early. They've done quite well, and they're in school. And so please get the right information, ask your community physician, and we're here with resources.
And another group that should really consider being vaccinated is, well, pregnant women, right? I mean, the CDC says that there's been approximately 125,000 confirmed cases of women, pregnant women with COVID in the U.S. Of those, approximately 22,000 have been hospitalized, and sadly, more than 160 have died. Last December, one of our community members was 8 months pregnant, and she was having some symptoms. She thought it was because of her pregnancy. She had an appointment with her doctor. She was coughing a little bit, and she ended up in the ER almost immediately. So we do want to share that story with you now.
I thought I'm feeling short of breath because of my pregnancy, and I did feel my baby kind of low already because I was 35 weeks. I had my appointment to see my gynecologist, Dr. Jones. When I coughed a little bit, he said, "Are you okay?" And I told him, well, I've been having a little bit of a cough. We went out of town, and that's right away when he said, "Oh, no. You have to go to the hospital." The lady came, and then she told me, "Oh, Maria, your results are positive for COVID."
When she first came in, they had placed her on some nasal oxygen. We were trying to keep her oxygen level at least 95% for the baby. She was at a higher risk than normal in spite of her youth because of her pregnancy. She also had gestational diabetes. When you see all this white like this, is what they call a ground glass appearance. And that's representing the pneumonia. Now the baby's at risk because the baby's not receiving enough oxygen through the placenta.
They were gonna do an emergency C-section. I was worried, But at the same time, I know that I needed to be calm for my baby because, I didn't want her to go through stress at the same time. Whatever you feel, they feel inside you. I have to be calm. I have other kids at home. I kind of said, please, God, help me. We just have to do whatever we have to do, to save my baby's life.
They ended up doing general anesthesia. She went to sleep and then she was intubated. The baby was also intubated and was transferred to Stanford. Her recovery was pretty quick. We were able to turn the oxygen down. Then we were able to take off the sedation, basically wake her up and let her breathe on her own.
The nurses did a FaceTime to see my family members, to see my husband, to see my kids. And then oh my God, I started crying. Oh my God, Mom, what happened to you? Where are you? Are you okay? Are you gonna come home? And oh my God, seeing their faces just kind of, So the baby's still at Lucille Packer. She stayed there for 5 days. I miss my daughter. So I didn't see pictures of her maybe until like a day or two after. Because nobody was there with her. All my family had COVID. I'm so grateful with all the nurses and the doctors, the respiratory therapist. Dr. Jones, he's actually the one that actually saved my life.
We want to thank Maria Llanos for sharing her story. Obviously, when she caught COVID, there were no vaccines. So as you can imagine now, she is definitely an advocate for vaccination. Couldn't imagine Dr. Gray and Dr. Lay, waking from this ordeal and not being able to see or even hold your newborn baby, and just the thought that she was a couple of hours north. That's just incredibly devastating, but it's a happy ending, so we're very happy about that and wish them the very best. Have either one of you treated pregnant women with COVID at Salinas Valley Memorial, or even you, Dr. Lay, in Michigan?
Yeah, so actually I've treated pregnant women in Michigan, and I have, with my short tenure here, I've treated one in our critical care unit. Just to briefly touch on the one at our facility, she was transferred to UCSF, but she was also in a very critical condition. It's sad, it's tough, and it wasn't her first child either, but it's definitely a child that she wished she got vaccinated. The long story short is, what I've heard is she's doing better and the child is doing well. And that's the best case scenario that we all wish for. Now, to turn that around, the pregnant women that I've treated in Michigan, granted this was before vaccination and before much data that we had, she was very ill. This was not her first child as well. And unfortunately, that fetus, we lost the baby. Unfortunately, but saved the mom. And she was intubated, like Maria said on video when she was intubated, but she had no clue what was happening to her or her child. And so when we finally extubated her, her first question was, "Where is my child?" And the child, we had to say, passed away. And those are the cases that we deal with. And so, which brings us to the next segment of vaccination. And I'll let Dr. Gray touch on our experience, but just quickly, I highly recommend pregnant women to get vaccinated. What do you think, Dr. Gray?
It's a very sad case that you had to deal with, and I'm sorry for the patient and her family. I've cared for several pregnant women and women who've just given birth at Salinas Valley Memorial, and it's hard not being able to see the baby that you just gave birth to. It's a danger to the fetus, to the baby, if they remain pregnant, with all of the complication that can happen. As you saw in the video, Sid, who's the respiratory therapist, explained that we need to keep the body oxygenated of the mother so that the baby gets enough oxygen. And with COVID, the oxygen levels oftentimes are very low. And so vaccination, again, is the best preventative, saving mom's life, saving baby's life, and allowing them not even to have to be in the hospital, because it prevents critical illness and allows the family to stay together and be healthy and happy and thrive. And there's a lot of misinformation out there about how getting the COVID vaccine right can make one infertile. And Dr. Lay and I were actually just discussing this. There's several new papers that have just come out that have looked at vaccinated women, one out in Norway actually, vaccinated women for COVID-19 who were pregnant at the time of vaccination compared to those who were unvaccinated for COVID-19 during their pregnancy. And no increased pregnancy loss or miscarriage. Yep. And less symptomatic and less critical illness in that population. And so I think now we can say with confidence that eligible patients, or everybody, should get vaccinated.
That's a great message. Thank you for that. Unfortunately, COVID-19 is not the only virus that we have to worry about. Flu season has begun. So who should be receiving a flu vaccine?
I believe all patients should be receiving the flu vaccine, except obviously those who have had prior allergic reactions to the flu vaccine itself. But in general, I think every person should be having the flu vaccine, along with the COVID vaccine. Just because the COVID wave came doesn't mean the flu's gone. The flu is always going to be there, and unfortunately, COVID's always going to be there. So one vaccine will not protect you from the other. You should get both.
Agreed. Anyone over the age of 6 months should get an influenza vaccine that's appropriate for them. In older patients, we give a higher dose, older than 65, because as we get older, our immune system doesn't react as strongly as when we're younger. So we give something called the high-dose flu vaccine. And typically in America, we have several 100,000 hospitalizations from influenza during a typical season, and more than 50,000 people who die of influenza per year. And we see them frequently in the intensive care unit. And again, that's very devastating for families, and it's the most vulnerable, right? So if you have a vulnerable family member at home, it's a loving thing to get vaccinated, both for COVID as well as for influenza, because you're less likely to transmit that. And then children under the age of 6 months don't get flu vaccine. And so if your family gets vaccinated, you protect that little one from infection, and that's very important. So we advocate that everyone get flu vaccine and COVID vaccines this year, and we've done it.
Yeah.
Went great.
Feels great.
Yeah.
I know I received my flu vaccine several weeks ago, and actually in October, Salinas Valley Memorial actually had 3 community flu clinics throughout the Salinas and South County area. So thank you to everybody who came by and got their flu and COVID vaccine. Yes. We appreciate that. Now, both viruses, COVID and influenza, have similar symptoms. So can you run through those symptoms? Because it can get a little confusing.
Yeah, I mean, for those who had COVID before or had the flu before, it's pretty much, it starts off the same, right? You get the headache, you get the muscle aches, maybe some bone aches, fevers, chills, you feel like you're shaking. Sometimes you might get nauseous. There's different symptoms, though, with COVID that we found because of the way the virus works, but you can have loss of taste or loss of smell or just any different neurological changes can be with COVID. I don't know if Dr. Gray has anything else to add to that in terms of symptoms.
And I think the hard part is they're similar. Frequent testing is a very important part of keeping each other in our community, in our workplaces, in our home safe. So I'll give you an example. Recently I just was feeling unwell, and I didn't want to expose my family or my patients, my work colleagues to anything, and so I just went and got tested. And I have a bunch of home tests that I've gotten, and so if I want to go see my mom and I feel like I have allergies or something, I just test, and that's a very good way to protect yourself and your community.
Great advice. Can a person be infected with COVID and the influenza virus at the same time? I mean, that's got to be really tricky if that's a yes.
Yeah, they can have a co-infection, just like how before we had influenza with other co-infections. When you're infected with one thing, your immune system is trying to rev up, but it also gets downplayed too, and it takes a hit. So you're compromised at that point, and it's definitely not good, but high risk to be co-infected, not with just the flu, but any other virus like RSV or human pneumometavirus, anything, adenovirus, or even something bacterial. This is something we saw widely with influenza per se, but definitely with COVID, you can see that.
And I think, we've all seen it now with the kids going back to school. Mm-hmm. We had a recent and still have an RSV outbreak, and we've had a lot of respiratory viruses that are not COVID that have been circulating and getting people sick. And I've had several of my patients in my clinic that are grandparents and have gotten sick. And so this year's very different than last year because, everyone's out and about a little bit more. So we need to be a little more, safe and engage in those mask wearing, testing, so that we all stay healthy.
So for those who are looking to make an appointment at their doctor's office, maybe Prime Care or doctors on duty, or maybe at the local pharmacy to get the flu vaccine, they can also make an appointment to get the COVID vaccine, but can they get both vaccines on the same day? Is that safe?
Yeah, I say it's safe. And, I actually got both of them on the same day. And I'm a fairly healthy person. You might have the little side effects that you felt before, if you had the vaccine before, the COVID vaccine, of just feeling chills. But, it's just your body reacting with the high immune response. I think it's totally safe to have it on the same day. There'd probably be some special cases where you need to run by your physician that if you should have it both on the same day. For instance, if you do have a state of immunocompromisation, or if you're already on any immunosuppressants, or if you recently got sick, or recently got COVID, or recently hospitalized, or chronic comorbidities like diabetes or kidney failure, I think it'd be first safe to discuss with your doctor. In general, though, without any of those comorbidities or significant severe diseases, I believe it's safe to get both at the same time.
I agree, absolutely. And the earlier the better. It's time. Yeah. And, the thing is that we still have over 60 million Americans who are eligible for COVID vaccination who have not yet gotten it. And, so we're still seeing a lot of spikes throughout the country. A lot of the healthcare system in certain parts of the country are really overwhelmed. And, if we add flu on to that, that could be very devastating. And I would like to add that, there are concerns that, about coming into the hospital. We are open. We are here to take care of you. If you're having chest pain, if you're having symptoms of concern, please don't be afraid to come to the hospital. Come in and get yourself looked at so that something more devastating doesn't happen.
And I think you're referring to in general, Dr. Gray, right? So if you're having any
Correct.
other type of symptom.
Oh, absolutely, yes.
Yeah, please do not delay medical care. We want to stress that the hospital is safe. Mm-hmm. Has been safe, it is safe. We're taking all the necessary precautions, so please do not delay care, whether you are having cold or flu-like symptoms or COVID symptoms, or think you're having a heart attack or maybe even a stroke. Please do not delay care. I want to go back to the flu. Last year, we didn't really have a flu season. So what do you think is coming our way? Because as you said earlier, people are a little more relaxed now than we were a year ago. We're out and about, we're back to work, walking around without masks. What do you see?
I see actually what Dr. Gray said earlier. It's going to be a combination rise of different viral illnesses. It's going to be the same things we saw in the prior years along with COVID, and maybe even more sick people with co-infection. So I don't think, like Dr. Gray said, people should be relaxed or calm that we lost touch of other viruses. Now that general gathering is happening more, or there's less severe restrictions on social gathering, there's definitely going to be a wave of other viral illnesses, maybe even bacterial viruses or bacterial illnesses. So I wouldn't downplay the fact that we're over, an influenza seasonal pandemic. It's going to happen.
Great.
And the holidays are almost here, right? So we're going to have a lot of people traveling for Thanksgiving and also for Christmas. We're hoping that people will continue to get those shots in the arm. But what's your advice to all those people who want to travel, whether it's to Mexico, Central America, or just throughout this country during this holiday season?
Vaccination, vaccination, vaccination. Protecting the vulnerable people in your family and in your sphere. For instance, if you have a family member who's immunosuppressed, whether they've gotten chemotherapy or they've had a kidney transplant, we know that a patient, for instance, that has had a transplanted organ, that they don't mount as much of a response to the COVID vaccine. And we've unfortunately seen several people have become critically ill who have had their full vaccination series, but because they take medications to decrease their immune system function so they don't reject the organ that's been transplanted into them, they just don't have that same response, they get sick. And so those are the patients that are very vulnerable at these family gatherings. So again, get vaccinated, get tested, ideally, before you go, isolate yourself. Wear masks with that family member. And if you can, have the activities outside and still wear masks. And that's, I think, a safe way to address the holidays, because we all want to see our family and be with them. But we want to do it safely, because last year was very devastating for a lot of families.
I think along with that, with the get vaccinated, get vaccinated, get vaccinated is what Dr. Gray said, but I would probably say the three things is wear a mask, wear a mask, wear a mask, and wash your hands, wash your hands, wash your hands. It's very important. Even if you're vaccinated, these are things you would still practice even if there wasn't COVID, right? If you had the influenza season, right, we still wash our hands. We still keep ourselves, in a hygienic state. So I would definitely say, besides getting vaccinated, keep all precautions like you had before. It's not over, it's always going to be here.
That's the next question I was going to ask you is, will COVID be here forever? I mean, do you see it ever going away? What's your take on that?
I'm not going to say I'm an immunologist specialist or an infectious disease specialist, but from what we've studied and the data we had on the patients we do take care of, and actually looking at microbiology itself of the virus, it's not going to go away, right? Just like the influenza virus, just like adenovirus, these are viruses. And you could talk to your local physician or even look it up for yourself, but viruses in general, they mutate fast. They mutate a lot, and that's how they escape us, right? And that's why we keep getting vaccinated, to keep up with these mutations. It's not going to go away, to put it simply, right? So, Dr. Gray, what do you think?
I agree with you. I think it's COVID's going to be with us for quite a while, and it's possible that it's going to be seasonal. Yeah. We just don't know yet. So again, get vaccinated.
And it was recently reported that there is a new strand in the UK. And if I remember correctly, I believe this is the 5th one now that we've seen in the last 21 months in terms of a mutation. So just another reason why we all need to get vaccinated, right? Yeah. I mean, if this is going to be a seasonal virus, well, then it will be, but our chances are better if we're all vaccinated.
Yeah, that strain that you're referring to is called the Delta Plus strain, and it has 2 additional mutations in the spike protein. And the thing that we're all concerned about is that it is 10 to 15% more transmissible, so you're more likely to give it to someone, than Delta, which was already an issue because it was much more transmissible between people, and that's why it's really devastated the world. So vaccines work against Delta Plus as well.
They do, yes. The vaccines, as contrary to what maybe some of the public may say, that, oh, just because I get vaccinated, it's not going to be against this variant, so why should I get it? It's actually been shown that it's been effective against these variants thus far.
Okay, is there anything else you'd like to say to our community about the flu and COVID-19?
Well, just in general, I want our community to be safe, being from the Bay Area, and Dr. Gray being from the Bay Area and around here as well. We love our community, care about it a lot. We love the people here, and we like to see people grow and be happy. And it's very devastating and tough for us when we see that opposite reaction in the hospital, and obviously death. The main message that I want everyone to know and get across is get vaccinated. It's safe. There's a lot of clinics out there. There shouldn't be no excuses to not get vaccinated. You can make time for it. There's no side effects, if any minimal side effects, and it would just be headaches, maybe some chills, but this should be transient and go away. And that's the same with the flu as well. And just be safe and be cautious and think about what you're doing. This is a world we live in where we're supposed to be altruistic. Just think about what you're doing in your actions, right? Because like Dr. Gray said, you may get your family member sick, even though you may feel some action you do may not get you sick. So it's very important to just think about the whole as a community and to keep everyone safe. We want to take care of people, and we love seeing people in general, but we don't like seeing them in the hospital.
I totally agree, and I think our goal is to provide safe and actionable information, and we want you to get vaccinated and wear masks, hand hygiene, gather safely, protect your families and your friends, and protect our community so that we can all continue to thrive and come out of this pandemic even stronger.
Great. Well, Dr. Lay, I know you've been with SVMHS Dr. Lay, I should say, for about 3 months, and I know, Dr. Gray, you've been with us a lot longer, but nonetheless, we thank you so very much for all that you do, have done, continue to do with our patients in general, not just COVID. We so appreciate you. We're very grateful for you, and we're very happy that you were able to join us here today and provide all this great advice and information to our community. So thank you very much.
Yeah, no problem. You're welcome. Thanks for having us.
Thank you for having us.
Of course. This video will remain right here on this Facebook page. Please like and share it. We so appreciate you watching, and we'll see you next month. Take care.